Hello, everybody. My name's Rachel Frondigoun. I'm the co-author of this report that has been led by Sheila. So welcome and thank you for joining us today. So this report is, as we say, housing associations and home adaptations, finding ways to say yes. It's about looking at home adaptations from the tenant's perspective to look at how we can make best use of this. Okay, I'm here to give you a little bit initially of a background to the report. We've heard a lot of it it came about from Paul meeting Mario in a corridor, which is definitely one of those things. It is here to try and support those of us that deliver the DFG on a daily, weekly, monthly basis, and then housing providers who are trying to find people appropriate and suitable accommodation for their needs and to keep them safe at home, and then the occupational therapists to bring all of those together to try and do that. So what were we trying to do through this report? What we wanted to do was to look in depth at how adaptations are funded and delivered within the housing association sector, including minor adaptations and the use of the DFG, because it's not straightforward. However much we might want it to be, it's far more complicated than in other sectors. We wanted to look at how funding arrangements could be improved and the delivery process made quicker and more effective. Because I know in my own experience that often it takes longer to get an adaptation completed within the housing association world than it can do for an owner-occupier, say, in a DFG process. We also need to understand that adaptations might not be the right solution sometimes for housing association tenants for all sorts of reasons that we will touch on in this presentation and that are explored in more detail within the report. And where that's the case, how we can look at how that moving process for those tenants might be improved. We often have that moving conversation quite a long way down the journey with a tenant or with a client when they're expecting to get whatever they want within their own home, and that might not always be possible. And there are other factors within the housing association and the rented market world that don't exist in other housing markets, and we need to be mindful of that and acknowledge that, because that is never going to change. We also want to encourage a longer term and more strategic view of home adaptations within the housing association sector, so that we can look at how those adaptations can be reused, how they can be made best use of, and what is it appropriate to do. Because quite often when we look at an adaptation, we're looking at meeting this person's needs in the here and now. We're not looking at what actually might make this whole property more appropriate for other tenants with similar needs in the future. And so we want people to try and take a longer and more strategic view. And just to say again, we're very grateful for the support that we've received from the various different sponsors. So funding. So it's really important to sort of point out at this point that there is not a national home adaptation service that has been designed to meet people's needs. What we've got is a whole bunch of services that have evolved from the many and various pieces of legislation and guidance that have come out from all sorts of different government departments, some of which match, many of which don't match. We've got different funding sources across the country with different partnership arrangements, which basically means that the tenants of Anchor, for example, in one area might get one level of service, but in another area, they might get something different. But equally, the tenants of one landlord in a local authority area might receive something different to tenants of a different housing association in that same local authority area, depending on how their landlord does it. So not only have we got the multi and various policies from local government around how they will deliver their DFG, we've got the multi and various policies of housing associations about what they will do. So put all those moving parts together and you can start to see the pickle that we've got. This diagram here looks and shows the various different funding sources that we've got housing associations, some of whom will have an adaptations budget that may form part of their major adaptations budget, major improvements budget, and they may either ring fence that, or they may have quite specific guidance about what they will and won't fund. For retained council stock, or ALMO and ALMO authorities, arm's length management organisation for those not in housing world, all their adaptations will be funded from the housing revenue account. You can't use the DFG allocation towards those, but in some places they may have to follow the DFG route. Within the local authority private sector housing, you've got the mandatory DFG, which many of us on this webinar will be familiar with, which housing association tenants can apply for. Some local authorities use their powers under the regulatory reform order to offer discretionary funding. So we might not means test something, we might passport other things through, we might just do stair lifts, for example, and that again will change. We've got health and social care funding through the ISIS budget. We've got other health budgets which we haven't put on this diagram because we'll be there forever. In some areas, housing associations, social care and health might be able to provide some top-up funding for expensive adaptations. In others, they don't. It varies from area to area, it varies from landlord to landlord, and it varies from CCG to CCG. So again, just some more moving parts. And for the tenants themselves, most tenancy agreements will allow these DFG adaptation improvements to be made. But also you will find on occasion, if somebody is on an introductory tenancy or it's a brand new property, then there will be limitations regarding what they are allowed to do in their stock because of housing legislation and tenancy. Within the report, we had a look at the profile of tenants and stock and things within the housing association world. So within housing association world, there are 54% of tenants report that they have a long-term illness or disability. 18% of new allocations are made to tenants who have a disability-related housing need that they have declared. With 43% of tenants nationwide over 55 and the average age of a tenant being 52, you can see how this starts to build a picture of need within the housing association world. 21% of disabled tenants say that their accommodation is unsuitable for their needs. And 56% of those people needing adaptations do not have them. We haven't covered it in this presentation as much, but there is a lot of there is a section within the report that goes into the fact that the housing association world used to get direct funding to cover adaptations within their own stock. And that was removed some years ago and transferred to the DFG allocation. So there are some challenges all around with that as well. So DFG investment, as we know, the DFG budget has gone up, but the number of adapted homes that we do has gone down. On average, about 36% of DFG allocations is spent on housing association tenants. But in some places that's more than 50%, and there is uneven use across the country regarding that. 11% of private households are in the housing association sector. However, the number of adapted properties within that housing association sector has gone down from 21 to 18%. So that means potentially that we are having adaptations removed. So when a tenancy changes, we are having those adaptations removed. Now that again goes back to the very start of this presentation when we said we want to look at a more strategic use of adaptations. Do we know why these adaptations are coming out? Is it because we're just sticking them in to meet an individual's need and that property isn't the most suitable for that person? Or is it because it's just being removed and we're not doing that? Or is it down to the design of it, therefore it can't be relet? Something which I know we'll touch on later on, and I know Sheila feels very passionate about as well. I also want to, just before I hand over to what the solutions and things were that we came up with, is talk about the different perspectives that there are in this world. So we've looked at the two perspectives within this world, if you like. If you take out obviously the tenant is the primary perspective, but we've tried to look at it from the local authority side and then the housing association side. So from a local authority perspective, each of the local authorities in England, for the purposes of today, deals with an awful lot of housing associations. I know when I was in a strategic housing function, we had upwards of 30 associations with stock in our local authority area. That's a lot of landlords to try and liaise with. Partnerships. There are some local authorities that had and have and still do have very good partnership arrangements with their stock holding authorities, particularly if they've got some major stock holding authorities. However, in the last 5 or 10 years, there have been an awful lot of housing association mergers. And that means that structures have changed and potentially contacts have been lost, which means that sometimes in some places those links have been lost. Some housing associations make no contribution at all to DFG. They simply apply for a DFG and that's it. Others will make a proportionate contribution, and that varies from our research. Anything from 10% to 60% of every adaptation done in any particular area is funded by the housing association. So that shows the disparity. We've got other associations where they will make a contribution up to a certain amount, and that's it. In the various bits of primary research we did in the online survey, we said that found that some housing association referrals were inappropriate from the OTs, and therefore it just went on waiting lists. We also, the feedback we got from the OTs was that getting landlord permission for works was often a delay, and it often caused significant delays in getting work done for people and leaving people in unsuitable properties, which was resulting in greater costs for social care. Communication was shown as a major issue. Again, we've got close relationships with some housing associations, but it's unclear who to contact in others, with people going in ever decreasing circles. There was a lot of concern being raised about adaptations being refused, particularly in general needs properties, and also about tenants being asked to move. And again, significant levels of concern around adaptations being removed at a change of tenancy. So when the person leaves, we take it out. We either don't or we don't have the scope and the facility to look for another tenant that would meet those needs, or the adaptations too bespoke. In the survey, most local authorities said that they would want associations to make a contribution to DFG costs, to make sure that adaptations are on the operational agenda and that housing associations are more aware of disabled tenants' needs. So it's not just about the money, it's around putting it onto that agenda, putting it onto the housing association agenda. On the flip side of that, if you like, or the other perspective, is the housing association. So housing associations often have limited budgets. They've often, at the moment, also got significant compliance pressures coming from government. Therefore, adaptations is getting moved down the budget, moved down the asset management priority list. Because at the moment, they can't be prosecuted for adaptations, but they can be prosecuted for compliance issues. There's often only one adaptations officer. We spoke with several national landlords who've got one adaptations officer covering the whole country. Only 10% of associations we employ an OT, and only 25% have got trusted assessors within their structure. Similarly to local authorities, the housing associations can be dealing with sometimes over 100 local authorities. And what they say is that for every authority, the paperwork is different. How they're expected to apply for it is different. The payment requirements are different. The funding contributions are different. Not all local authorities offer a full HIA service. Some want 3 quotes, even if the work's going to be done by the in-house contractor. Warranty and maintenance provision varies. The feedback from the housing association sector was that they don't always know that works have been completed, therefore they can't update their asset registers, therefore they don't know whether we've done what we said we've done them. More than one association adaptations officer reported having many and varied spreadsheet needed to monitor all the different arrangements with all the different local authorities. Quite often, DFG installations are not the same as the association's own specification, meaning that quite often associations are struggling to repair and maintain them. So their man in a van, if you like, from their repair service turns up because it's broken down 2 years later, and they can't repair it because it's a different specification to what normally goes in if they were doing it themselves. So that specification issue is a real problem for them that potentially as a DFG provider we're creating by being inflexible over our specifications. The other hat, if you like, that landlords wear is that they are the landlord, and they are being asked by different bits of our local authorities to manage long waiting lists, to have best use of stock policies, to make best use of family homes where we've got high demand for homes, and make sure that they make appropriate lettings and encourage people to move on. So potentially different parts of our own authorities are making conflicting demands on landlords. And we must acknowledge that sometimes that landlord function might be in conflict with the adaptations function. But a couple of quotes at the bottom here. One, I have a landlord head and a disabled adaptations head. Another one is at the bottom there. You get so confused about who is doing what. You have so much to have to know so much about so many different places. I wish we'd all offer them the same way. The feedback from the Housing Association is that they desperately want and need consistency in the way that the DFG operates and in the way that we deal with them. Because so all of this together puts some really significant barriers in place for our tenants. We've got so many handovers within the process for a tenant. It's very difficult to put the resident at the centre. They've got no central point of contact. They might be talking to their landlord and their housing officer. They might be talking to their OT. They might also have a caseworker in the home improvement agency, all of whom are potentially talking together at the same time. You've got there it's a cracking diagram that shows in the tenant might come in through their landlord. They might come in through social care. They might get some minor works done. They then might go to social care. They then might go to the DFG authority. Then it might go back to their landlord to give consent. Then either they might need to move or somebody will do them a survey. Then we might get the works done. Then if we're lucky, we'll make sure that the Housing Association property team know and the database gets updated. And then that feeds into the allocate letting system so that if the property becomes void, that will also get updated as well. But the other thing to note here is that we often don't start talking to people until this bottom right-hand corner, when they've potentially been through they could have been through 5 different stages before anybody talks to them regarding whether or not adapting that home is the best thing for them to do. We don't have enough focus on prevention and early intervention. The landlord might not know about this until they receive permission saying, can we do this to this house, please? Whereas the landlord might be in a position and might know that tenant to be able to have that discussion with them. So a question just for the ether at the moment is, where should we be having those conversations around whether it's an appropriate thing to adapt a home or for people to move? People don't come for adaptations until they're at crisis point. All of this complex pathway also means that it's incredibly difficult to measure outcomes and improve performance because there are just so many moving parts. Okay, so it's been fun up to now. So I will now pass over to Sheila.
Hi, thank you very much, Rachel. I'm Sheila Mackintosh, and I did a lot of work to do the interviews for this report and to write the report. And it's one of the most difficult pieces of work I've ever done. It was even more difficult in some ways than writing the DFG review, because it's so complicated. There's so many different players involved, all with different policies and all the different funding sources, that trying to untangle it was quite complex. And then trying to come up with solutions was even harder. what I want to say, first of all, in terms of solutions, that there is a lot to build on, that housing associations are doing a lot of good work. And what I was very aware of when I was talking to people on the phone, that the staff are incredibly committed and they really are trying to make things work the best possible way they can for their tenants. And we know that the local authority staff are the same. Everybody's very, very committed and very, very passionate about what they do. But it's the kind of systems that they're working with that have come from so many different places that are difficult to deal with. There are some associations around the country that have really good services, fully integrated services, and they tend to mainly be the big transfer associations where they actually had a specified budget when they were set up. So they've got big budgets, they've got specialist staff, often employ their own OTs, they control the whole process, and they're able to join it up with their other services so that it's completely integrated, streamlined service for the tenant. And WDH in Wakefield is a really good example of that. And there are others around the country as well. But there aren't that many of those LSVTs that are kind of locally based anymore. An awful lot of organisations have merged, they've joined into bigger groups. And sometimes, well, from my experience, the good practice tends to get diluted. It doesn't actually maintain when the mergers happen. But nevertheless, we still have some very, very good partnership arrangements with local authorities, and some of you are working really well with your housing association partners. In terms of minor works, I did a lot of work with housing associations, quizzing them about what they were spending and what they were spending it on. And their minor works budgets varied enormously. Some were able to do almost everything. You know, they could certainly put in a straight stair lift, they could do reasonable size ramps, they could do an awful lot of work. But others had such tiny budgets. In 1996, when housing associations were asked to take on minor works, the limit was £500. For a lot of them, it is still £500. And that is just not enough to do very much. So that's why OTs are seeing referrals coming through that they deem inappropriate. It's things that would be much, much easier for the housing association to do themselves, but they need a better budget. Now, encouragingly, I was going back and talking to people again as I was writing up case studies. And quite a few people were saying, well, actually, we've increased our budget now. And I'm not quite sure whether that was because of our conversations or because there is actually a change in the mindset. We've had the Charter for Social Housing, which was published in 2020, which, you know, it's come out of really the Grenfell fire. The whole ethos of kind of the housing association movement is changing. It had been very, very focused on value for money and asset management. And it's now moving back towards what used to always be the kind of policies of housing associations, which was to care for their tenants, to really listen to their tenants and look after them. So there's a much more consumer focus now. So I think this is a good time for this report. I think we've got an opportunity now to make some changes. Other housing associations that we cited as good practice are doing home MOTs, you know, home safety checks. And some are doing it actually for local authorities across tenure, but they're then focusing on their own tenants and trying to really improve the situation for those, either helping them to move or to do the adaptations that are needed. There's also quite a lot of work being done on housing options and, you know, some really good housing association services. There always have been, and housing associations have always contributed to home improvement agency services. They've funded them, supported them, often given them an office space. So there's a lot of work being done there that we could build on. And some are working very, very closely with their disabled and older tenants. They have them on the board, they have scrutiny groups, and they're doing a lot of work to try and improve design by working with their tenants to find out what tenants want. Okay, so we've got good practice, but we've also got a real muddle about funding and delivery and who's responsible for what and who should deal with things and when should things be passed on and handed over to somebody else to do. So we've come up with some options and we've explored some of them in more depth. The first option is just to carry on with the current way we do everything, the current funding and delivery system. Now, for some people, it seems to work quite well, and they probably don't want to change things. But we feel generally, having weighed everything up, that it's not going to work long term. There's too much inequity in the system, that tenants in different places, as Rachel was describing, are getting different services. It depends on who their landlord is. It depends on who their local authority is. And we need to get more equality across the country. So how do we do that? Well, another option might be to get housing associations to pay for all the work themselves, like the Council Stock and the Elmos use their HRA. Perhaps we could have done that when direct funding for housing associations ended. It finally ended in 2008, but it had been kind of slowly diminishing over the period from 1996 onwards. I think if we'd done it then, yes, it could have worked, but it would have needed a change in legislation. As it is, the DFG legislation allows private sector organisations, which is housing associations, to use the DFG. So that isn't really an option. A third option is to go back to direct funding, which housing associations used to have, and it's continued in Wales. They still use that system. It works very well in Wales. Like housing associations get a really quick turnaround. They work directly with the Welsh Government, and every time they do an adaptation, they apply for funding for it, and they get 15% to cover the on-costs for OT technical support, etc. We could do that here, but I think it goes against the need for local partnerships. And I think we actually need to integrate things better. We need to integrate adaptations with rehousing and move on services. So direct funding isn't necessarily going to help. There are two more options, 4 and 5, are about housing association contributions. What housing associations kept saying to us was, please, can you make it consistent? You know, we give 20% here, we give 50% here, we give 25% over here. We don't do anything, we don't have to give anything in this authority. Can we all do it the same way? So one option is just to remove housing association contributions altogether, just fund everything from the DFG. Now, that would work in areas where you've got sufficient funding, but we know that there's some local authorities where the DFG budget is very constrained indeed, and trying to do that would be impossible. And particularly in some areas, the DFG is sometimes 50% of the DFG is going to housing associations. We have to have contributions in some of those areas, unless local authorities got compensated for the removal of that contribution. Another alternative is to have a standard DFG contribution. And that's what local authorities said actually would be really good, because of what Rachel said, that it puts it onto operational agendas. It actually, you know, gets local housing associations to really take notice of their disabled tenants and improve services. So standard DFG contributions would work, but how much? 20%, 30%, 40%? We haven't specified. We think that that needs further consultation as to what that should be. And again, some local authorities would need compensating if they lost contributions. The last two items are things that are easier to implement right now. And these are the two that we want to focus on now. One is landlord applications and the other is top slicing. Landlord applications, we've had a lot of discussions with kind of the staff within foundations and talking to various people in local authorities and housing associations about what might work. And this seems to be the best solution to a lot of the problems of delays within the system. And that issue about how on earth do we put the tenant at the heart of adaptation services. So if we take the tenants first of all, if we use landlord applications rather than tenant applications, The tenant has a single point of contact. They know that their landlord is in charge of this piece of work. We hope that there will be fewer delays because the landlord is not going to, you know, they've got to fill the form in. You're not chasing the paperwork in the same way as you do, you know, kind of after somebody's been through the assessment process. For the tenant, there's less paperwork, in fact, no paperwork. And also under the 1996 guidance that this is based on, there's no means test for the tenant. So that would be a real advantage for those who have to make a contribution. And it's really good in terms of prevention because it means that earlier point of contact and conversation between the landlord and their tenant, and that better conversation about housing options. Should they stay and have the house adapted, or should they move? For landlords themselves, there are major advantages because the contract is between the landlord and the person who carries out the work, the contractor or the tradespeople, and they would find it much easier to resolve problems. They can also do their own CRM compliance, which is something that they're handing over to the local authorities at the moment, which they don't really want to do. They can also control the design better. They can use their own standard fixtures and fittings rather than the DFG ones, and they could, you know, top up more easily to get better fixtures and fittings. And they could also do any repairs and improvements at the same time, which they find it difficult to do at the moment. For the local authority, you've got a form with a named contact on, so you don't need to do any chasing, and you know that the landlord's agreed before somebody's actually coming through the process. Under the 1996 guidance, you can also reclaim equipment like stair lifts and hoists, and you've got nomination rights if you want them for 5 years to make sure that property is recycled and let to another disabled person. But there are disadvantages. The tenant may need an advocacy service. At the moment, OTs and DFG teams can act on behalf of the tenant if the landlord is being difficult about giving permission. So if you take that away, it does make the tenant a bit more exposed. They do need some more support. There is actually a Make Things Right website now for social housing tenants, which means that for more serious complaints, it's much easier to complain, and it's very easy to find where that is. For landlords, there are disadvantages. Some of them actually don't want to take responsibility, so they would be, you know, less likely to want to take charge of things. But for many, they do. So I think a lot of them would really welcome this. And for local authorities, there's a loss of income with the means test. Top slicing, well, that would work best where you've got really close relationships with a single housing association. Ideally, they would employ an OT or have one seconded. It's a much faster, more seamless service. It would be much like the WDH service, but they would have to provide the output and outcome data so you can fill in your Delta return and meet your statutory duties. I'm just going to whiz through these. There are some forthcoming issues that there's going to be a consultation on, hopefully this year. And they're things that were brought out in the DFG review. One is about the works over the DFG upper limit, and we suggested solutions in the DFG review. And in this report, we've said that housing associations should use their capital budgets, not their tiny minor works budgets, if they need to do top up, because there will always be a need for top up, and they need a business plan for that. The allocation of DFG resources is a very, very important change. It needs to be up to date, it needs to be transparent, but it also needs to take account of housing association use of the DFG, because that's really high in some areas, and that isn't actually taken account of in the allocation formula at the moment. Changing the means test, it's actually very unfair at the moment. It's operating differently in different authorities, and some housing associations top up if a tenant has to pay, others don't. So it's actually quite inequitable the way it's operating. So we do need to change that, and perhaps we can align it with the new social care charging arrangements. Adaptations to common parts, that was announced in the National Disability Strategy, that Section 36 of the Equality Act will finally be introduced. I mean, the Equality Act was 2010, and that Section 36 has been put in the too difficult drawer for too long. But again, after the Grenfell fire, we've got to make sure that people can get in and out of properties safely, but it could have a major impact on the DFG expenditure. And there's a lot of issues that still need to be resolved, which we've listed in the report. And finally, there's funding for handyperson services coming. We don't have any details yet. I just wanted to point out a lot of housing associations don't have a handyperson, and they would really, really like one. So it may be where partnership arrangements could work better across in local authorities. These are the recommendations. I'm not going to go through them. You can read them in the report, but it's about getting decent budgets, effective staffing levels, using landlord applications, using these capital works budgets, improving the information and asset management databases so we can improve the rehousing process, much more preventative work about future housing needs. You know, the routine housing reviews should be picking people up who need adaptations or to move 5 years earlier than they are doing at the moment. And we need a better managed rehousing process to match disabled people to adapted properties. And then for local authorities, it's using these landlord applications. And we've given you an example because it's very, very important that the same form is used across every single local authority. We've got to have consistency to make this work. And we've given you an example. And top slicing DFG funding is another way of going forward. For central government, it's that important update of the DFG allocation formula must be addressed and must be addressed quite soon. And we need to get them to work with Homes England to decide what is a fair contribution if housing associations are going to make a contribution to DFG, make that consistent across the country and resolve those issues about the funding of common parts before Section 36 is implemented. And finally, for Homes England, we need, there will be a new inspection regime. Every housing association with more than 1,000 homes will be inspected every 4 years. Now, way back in 2008, the Audit Commission used to do inspections, and they used to look specifically at adaptation services and look at how housing associations looked after their older and disabled tenants. I would like to see that reintroduced as part of the new inspection regime. So I'm hoping that the housing regulator will listen and will take that on board. Okay, final slide is about the importance of good design. We've got to take away the stigma. Every adaptation we do is an advertisement to somebody else, and they're going to look at it and think, do I want that in my home or not? And we've got to get people coming forward earlier so that they get a better quality of life in later life, or if they're of younger households, that they have that freedom to live their life as they want to. So we've got to remove the stigma. We've got to also, that's really, really important to make sure that in the rental sectors, and that's across social housing and the private rented sector, that more adaptations are approved and fewer are removed at change of tenancy. There's no need to remove them if they're done well, because they'll look good and they'll remain in good condition. We need a longer, more strategic approach, longer term, more strategic approach to adaptations to make to add to the inclusive housing stock. We've got a situation at the moment that the number of adapted homes in the housing association sector has been declining. It shouldn't be. It should be going up. And we need to make that happen. It's going up in the council sector, maybe because they pay for their own adaptations. So we could make it work better. And we need a more circular economy, and we need less waste and much more recycling. Okay, last slide just shows you where you can, what we've done. We've got a summary report, and then there's a really detailed background report. And Foundations is beginning to develop a design guide, which hopefully will appear on their website very soon. But you can find the reports in the library section of the Foundations website. Thank you very much.